While I was doing some research about the impact of iodine on your thyroid health, I came across this really interesting research article which talked about the Wolff-Chaikoff effect of the impact of iodine on your thyroid gland. So in today's video, I actually want to share this information with you because I think if you are a hypothyroid patient and you are taking iodine, this might be something of value to you. So in my previous video, which I will share a link with down below in the information box, I talked a little bit more about how high doses of iodine may actually trigger thyroid autoimmunity. But in this case, now we're talking about how a high dose of iodine can actually slow down thyroid hormone production. Now, we may think that, okay, your thyroid gland needs thyroid hormones, so therefore if we take more iodine, surely then my thyroid will create more thyroid hormones and therefore I should have more thyroid hormones and my hypothyroid symptoms should disappear, right? Well, not. Our bodies is tricky. So when you suddenly take this high dose of iodine, it's like your thyroid gland is going, whoa, 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 that is way too much. We don't want to cause hyperthyroidism, so therefore the thyroid gland is then down-regulating your thyroid hormone production. And you may actually, for a short period of time, experience hypothyroid symptom. But this should be temporary. So this is almost like your thyroid gland going, hey, there's a lot of iodine, I'm going to take a little bit of a holiday from making thyroid hormones until iodine levels get back to normal. Now we know that the thyroid gland is extremely sensitive to iodine levels in your blood. So you want to make sure that your iodine is just right for you. So not too much, not too little, almost like the story of Goldilocks, right? So what may actually cause this spike in iodine and then this downregulation effect? Well, if you eat a huge amount of sushi all at once, then suddenly you might actually have a spike in iodine. Some medical treatments may actually require you to take some iodine, like what they do as a contrast to do a CT scan. Then you actually may experience this spike in iodine and this downregulation effect of your thyroid gland going, hey, back off a little bit, I need to protect myself. And let's not forget that certain medications like amiodarone, which is often used to treat heart conditions in patients, may actually also create spikes in iodine. Now it gets really interesting. In the research, they actually say that this effect could last, for 7 to 10 days if you have this sudden spike in iodine. But what happens if you continue this dosage of iodine? That's what they call the escape of the Wolff-Chaikoff effect, and it actually has a completely different name. And this is called the Dijon-Basdo effect. So this is now completely the opposite of the Wolff-Chaikoff effect. And this is where your thyroid is now going, all right, we have all this iodine and let's have a party. And suddenly your thyroid goes into hormone production overdrive. And now you experience too many thyroid hormones in your body and you may actually experience hyperthyroid symptoms. Talk about mood swings. Hypo the one day and then you could actually switch to being hyper the next day. This is just insane. So for those of us with thyroid issues, it's actually really important to understand this, because if you are suddenly taking iodine, for whatever reason, you might be taking a supplement, and often these thyroid supplements also have iodine hidden in them. So always remember to read your labels. You actually want to understand so that you know when you have a conversation with your doctor about your treatment plan, and if you're suddenly experiencing all these symptoms, which is hypothyroid symptoms the one day and hyperthyroid symptoms the next day, that you actually understand that the cause could be iodine. So what can you do if you suspect that you've had high doses of iodine and that you might be having this Wolff-Chaikoff effect, or then the escape of the Wolff-Chaikoff effect? I think it's really important that you speak to your treating medical doctor about the options, because you might need just to wait it out and wait for your iodine levels to normalize. Or you might also want to consider doing some blood tests just to check how your thyroid is doing with the high levels of iodine that you've had exposure to. So that's it for this really interesting research on the Wolff-Chaikoff effect, on the effect of iodine on your thyroid. If you like this video, please give it a thumbs up. I would greatly appreciate it. And please, please, please hit subscribe. Yes, if you are a thyroid patient, hypothyroidism or Hashimoto's, this is the channel for you. So hit that subscribe button and click that bell so that you know and you get notified when I upload a new video, which is all about thyroid information and thyroid tips. That's it from me today. Take care and we'll speak soon. Bye.